So good morning, everyone. Thank you for joining us today on this beautiful Tuesday morning. I want to thank our guest, Quinn, who is from the Connecticut Office of Health Strategy, and she can talk to us about what that is and what she does there. The sponsors and hosts for today's event are both the Windham Region Chamber of Commerce and the Town of Windham, and Yuki, our magnificent grant writer and economic development person, is here also as a host. Yuki, did you want to say a few words?
Sure.
Yuki?
My name is Yuki.
Hello.
I'm representing the town of Windham. Can you hear me? Hello? Can you hear me? I'm not muted though. Oh, okay. Hi, I'm Yuki representing the town of Windham. We're really excited today to have Quinn and to learn about the cost estimator. I'm the grant manager for the town of Windham. Thanks.
Okay. So Quinn, let's turn it over to you. You can talk to us about what you do at the Connecticut Office of Health Strategy and what the cost estimator is. So I'll turn it over to you.
Great, thanks so much for joining me today. I wanted to do a brief introduction and then I'll go over the overview of the cost estimator. I'll do an orientation of the tool, breakdown of costs, and then we'll do a Q&A and some discussion. So I know this is set up as a webinar, but I hope that you're going to be able to participate in some way. We have a survey, but we also have some questions that we'd love for you to help answer. So to start, my name is Quinn Trong. I am a consultant with the Office of Health Strategy, and my job is to make sure that everyday people's voices are heard to inform the health policies that is coming out of the state of Connecticut. And as part of that, our taxpayer dollars have been invested into creating this tool called the cost estimator. So part of my job today is to share with you information about this tool that is now free to everybody and available. And then I would love to hear your feedback about what's great about this tool, what's not so great, what are some gaps, and how can we make the tool even better and more friendly to everyday people. So that's my basic work today. And today I also have with me my colleague Dashni. So she's right on the webinar with us, and so she's going to help take notes. So if you have any feedback or comments that you want to make, she's going to make sure that those feedback are noted. And as with anything, we're not going to mention your name or attach anything to your identity specifically, but we will use your feedback as a way to improve the tool. Does anybody have any questions before I move forward? No? Okay. Great. So I did my introductions. Now we're jumping into overview. So basically the cost estimator is for consumers. It's anybody who uses healthcare in the state of Connecticut. This includes people on private insurance, but it doesn't include anybody on Medicare or Medicaid, which is like a whole separate system. So people who are on the Excess Health Exchange, people who get employer-sponsored insurance, people on the state insurance plan, anybody who uses that insurance can use the cost estimator. And what does the cost estimator do? It calculates the typical costs of specific medical services and procedures. They are trying to get an array of different services and procedures onto the tool, and every day they're loading more and more so that you can get a sense of how much these costs are at various different healthcare facilities across the state. And they are gathering this information from the All Payer Claims Database, which was created in 2012 after the Affordable Care Act. The All Payer Claims Database basically aggregates all of the information that insurance companies send to us and to the Office of Health Strategy, and then it shares this information through this cost estimator tool. The purpose of the cost estimator is to make sure that you as consumers get a sense of the typical costs or the typical paid amounts for common healthcare procedures and services at various facilities across the state. So these costs are also known as the median costs, and they're based on amounts that have been paid by health insurance companies and by the consumers together to the facilities for the services that are provided. So just to kind of, give you an example of how the cost estimator can be used, I'm going to use Bonnie as an example. So Bonnie is, a typical person. She lives in Danbury and she needs carpal tunnel surgery. And so to have a reference point for where she ought to get this surgery, she can use the cost estimator to know the median costs or the typical costs of insurance that insurance will pay for the procedure, and she can compare across different facilities to see what are these costs across the state of Connecticut. Some of the limitations of the cost estimator are that the actual cost that somebody pays, it can vary based on various factors of the person's individual health insurance plan. So just know that it's an estimator. It doesn't give you the precise cost, but even that estimate is helpful so that you can understand how much you might need to budget for something. Also, only the negotiated rate is represented, and the estimates don't include all the charges of healthcare services. It includes a lot of them, and we'll go over what costs are represented. So why the median and not the average cost? It's because if there are if there's one procedure that is that was done in an emergency, that procedure could cost a lot more than it usually does. And so that'll skew the data and give you an incorrect sense of how much it might cost to have the procedures. So that's why the median costs. Here is a link to the cost estimator, healthscorect.com /cost estimator. Usually I have a chat box, and I am able to put this into the chat box so that you can start checking it out yourself. But I want to encourage you to, as I make this presentation, to type this into your phone or to type this into your computer so that you can check out the cost estimator for yourself. So here's an orientation of the cost estimator. So here's what it looks like when you get onto the website. Oh, and Dashni just let me know that she put it into the chat box, so now it's available for you. Thank you, Dashni. So basically, you start by choosing outpatient or inpatient, like what type of service do you think you want? And under outpatient, you can select the kind of service that's available. Then you select the city or town that you want to be based in if you need that. You choose the distance, the radius from that city or town that you've chosen, and then you can sort by typical cost, or typical cost from high to low, typical cost from low to high, or the closest distance to your selected city or town. And then there's a map over here. There's a map right here where you can see all the different services and where they are based on what you've chosen. And then when you scroll down, you'll get more information. So I just want to make sure you all understand the terminology. Outpatient services typically happen during the day and don't require an overnight stay. It can include surgical and diagnostic services. Inpatient services require an overnight stay in a hospital when you're recovering from surgery. So that's the difference between outpatient and inpatient services. And then basically, when you select outpatient services, this includes surgical services as well as diagnostic services. Surgical services can include carpal tunnel relief surgery, and it includes the cost of surgery, anesthesia, surgical supplies, and medications. So those are costs that are included in that price. Diagnostic services are like x-rays, and then you would get charged for the actual x-ray procedure, the cost of using that equipment to do that, as well as the provider time for the interpretation of the x-ray and for administering the x-ray procedure. For inpatient services, all the services that are medical, surgical, and diagnostic rendered during a hospital stay are included, and they generally include a lot of surgeries and that require a more intensive hospital stay. So when you choose whatever you want to choose in the cost estimator and you scroll down, then you see a chart such as this. So I just want to kind of go over a few aspects of this chart. So here you have the facility. So facility is just, you know, what facilities are offering a particular service. In this case, I think we put in a cesarean section or something. And then to the right of that is typical cost. And underneath that is like all the typical costs of that surgery. And then to the right of that is, you know, just like the cost breakdown by the bar chart. So typical cost is the estimated median amount paid for the service. That includes both facility and professional or provider costs, as we went over. Over here, you're going to see the Connecticut median cost. That is the amount for services at individual facilities compared to the median typical cost across Connecticut. Oops, oh dear. There we go. The cost breakdown, which is right here, you know, there's like an up arrow or a down arrow. It's just, you know, this whole thing is like a bar graphic of the typical cost broken down by the facility and professional costs. And this icon helps indicate whether or not the typical cost is above or below the Connecticut median cost for the service. So it's a nice little reference point. Yes, okay. So now if you hover on any of the bar charts, you will see a few things highlighted. This little box, this little nice box is going to pop up, and it shows you what is the facility cost, what is the professional cost, and what is the typical cost of the whole procedure. So as you can see, the typical cost is the sum of the facility cost and the professional cost. The facility cost is the room and board, medications administered, and the lab work that's performed. And the professional cost includes services linked to a provider's time, such as an anesthesiologist, physical therapist, or any other consultation services that you get at your healthcare facility. The charge amount is the amount that you would be charged as a healthcare consumer if you didn't have health insurance. So you see there's a huge gap between the typical cost and the charge amount because health insurers generally are able to negotiate a lower rate for their customers. All right, next. Right, so this goes over what the typical cost is. So it's the estimated amount paid by the insurer and the amount paid by the patient. And the charge amount is the amount charged by the facility that you might have to pay if you are uninsured. Data exclusion. So basically, the cost estimator does not include any information about procedures where at a facility where there are fewer than 11 procedures per facility. This is because they want to make sure that there is data privacy. They're governed by HIPAA laws, so they want to make sure that we don't share information about people, especially if there are 11 or fewer procedures at a facility. If there are any zero or negative charged amounts, and maybe that happens because somebody got a deal on something, maybe there was, I don't know, a special circumstance, that information isn't included because that skews the data downward. It makes the prices look lower than they actually are. All emergency department services and claims associated with ambulance transportation is also excluded because those are non-elective services and they skew the costs upwards. They make it look like things are more expensive than they actually are. Anytime you get an emergency service, it tends to be more expensive. And then for non-commercial information, like I said, Medicare, Medicare Advantage, Medicaid, none of that information is there because those are such big insurers that you know, they have their own negotiated rates. So that data isn't included. So I wanted to give a little bit of time to see if anybody had any questions. All right.
I think you're good. No questions that I can see in the chat or question and answers.
Okay, terrific. Thank you. All right, so no questions. So here is a link to the feedback survey. Dashni, if you can put that in the chat box, that would be terrific. But this feedback survey is one way that you can, give us feedback about what you think about the cost estimator tool. You're welcome to jump online anytime you have, 5 minutes of free time and test it out. And then jump onto the survey. The survey shouldn't take you more than 5 minutes. And, then we'll get some more robust feedback about how we can make the tool better for Connecticut's community members. And so now I wanted to kind of shift into having a short discussion with you. I don't know if that's possible within this webinar format, or if that's even what you're capable of doing, but we do have a few discussion questions that we wanted to pose to everybody. So I wanted to just check base with Diane and see what she wants to do.
I think that at least we can answer the questions. Steve, are you there? Are you able to allow anyone else to talk with us?
Sure. We just need to turn them on if they want to ask a question, or they can submit it through the Q&A or the chat, their choice.
Okay. Great, thanks. So, so I'm just curious to know, what is something interesting you learned about the cost estimator? And, I just love to get a sense of what do you find useful? What's good about it?
I'll jump right in and say I thought it was very interesting on the example that you gave at the difference in costs across different providers, and that what you're showing is the median, which is the very middle between the highest and lowest, not necessarily the average, but I think it was really interesting to see how those rates varied. Do you have any input or idea, or can explain why there's such a variety of pricing or costs?
I mean, I can make some conjectures, but I can't say whether or not that can be validated. My guess is that different hospitals or different healthcare providers are in different places in the state, and maybe they're charging prices that they know would work for their local community. We know that a lot of people tend to go to the healthcare provider closest to them. So probably, a Fairfield County healthcare provider is probably going to cost more than, a Hartford area county healthcare provider. We also know that some hospitals charge higher rates because maybe they have a certain brand that people will pay more for. Maybe they are known for a longer time and have a history of providing superior services. Maybe they pay more for their healthcare providers. I mean, there's a whole range of reasons why healthcare providers pay more or charge more. But I think what the cost estimator is trying to do is trying to show people price transparency and trying to help people understand that, there are median rates across the state of Connecticut that you can look to. They're hard numbers that are based on real data that health insurers have provided, and they can use that as a starting point for negotiation, or to think about budgeting, or to reach out to the healthcare provider and to say, why do you charge more than this other healthcare provider? Is there a way to make that price different, right? So I think that's the hope, to bring that information to the public.
So you keep talking about doing, negotiations. How easy is it to negotiate with the provider and or your insurance company? Where is the negotiation taking place? Why is this information useful for that?
I think that's a really excellent question. And I mean, there's my personal thoughts on the matter, but I think that's a really good question. I don't know how often people negotiate their rates for healthcare services, and I don't know if people feel empowered to do that, and I don't know whether they would want to negotiate directly with the healthcare provider or with their insurers. I think that is a good question to put out there to the Office of Health Strategy, and to say, what is the purpose of this price transparency? How is it going to help consumers? I mean, that's what I'm getting from your question.
Yeah, I think
Yeah.
that's really key, because why would I use this? Why would I want to go on here? If I'm shopping for a product, if I want to buy a blue dress made by a certain company, I can shop 10 different websites and get the best price and purchase it from there. Is that what we're looking at here, to a more consumer-based, competitive system?
Yeah, I think that's a good question, and maybe that's what they're trying to do with this tool. I can't say for sure what their overall goal is. I do know that they're interested in putting out price transparency, but then your question brings up a good point. Like, who is this tool really for? Is it for everyday consumers, or is it actually for policy researchers, or is it for other insurance companies to know what their competition is paying? Or I don't know. I think that's a good question.
I think that would be a really important part of this, because it's great to know that if I go to Hartford Hospital, the average procedure is $4,400, but what do I do with that information? Do I get to go in ahead of time and say the average is this, or can I even go to my providers and say I want an estimation first? Like, you hire a contractor to put a roof on, they give you a written estimate. Can you get a written estimate from your healthcare providers?
You should be able to. My understanding is part of why this whole process is being put out there is to encourage consumers of healthcare to be more proactive about seeking out, the best price of healthcare for themselves. Because if not, then they'll pass on the price of healthcare to their insurers, and then the insurers come back every year and raise the premium 20%, right? And so part of capping the price of the premium going up every year is to make sure that consumers feel empowered to make good choices about choosing the most cost-effective care possible. But once again, you bring up a good question, Diane. Like, what part of it is a cultural question. How do you shift the culture to get more people to just ask these questions of their healthcare providers? Because I don't think price is discussed really at all with healthcare providers. But another part of it is like, which doctors' offices or which healthcare providers are going to be more open to this kind of discussion than others. And I don't know the answer to that. I think the point of the cost estimator is simply to say, these prices aren't the same across the state. So you should know that in consuming healthcare. And there's a way to shift that price as a group of consumers potentially. But yeah, I don't really know how we as individuals can necessarily make sense of that. I think it's certainly, for me, I would use the cost estimator if I'm thinking about doing an elective surgery or an elective procedure, to just say, I'd love to get an estimate of the healthcare so that I can budget and plan it out. And here's what I know to be the median cost in our area. Can you make sure that it's in that range? And here's my insurance. What do you think? So I think it's like a whole discussion thing. But yeah, how many consumers are going to have that kind of wherewithal or ability to like do all of that? I don't know.
So I'll come back to that discussion in a second. Let me answer a few other questions. In the example on one of your slides, you listed some hospitals, but there are a few that are missing. I mean, in our region, we have Wyndham Hospital. Is it just that you didn't scroll all the way down to all of the lists of hospitals? Are they all included in the cost estimator?
Yeah, so all of the hospitals that I know about are included in the cost estimator. So let's just see something. So arthroscopic knee surgery. I don't know if you see this. And I'm going to choose Wyndham. Let's see, Wyndham. And we're just going to do 35 miles of Wyndham. We're going to have it by typical cost. And then what I'm going to do is I'm going to scroll down. Oh, what is going on? Come on, cost estimator. Oh, I guess they don't do arthroscopic knee surgery. But they do, yeah, so arthroscopic rotator cuff repair is on here. Yeah, I don't know if Wyndham Hospital is included. I mean, what do you think is a service that Wyndham Hospital would?
Babies. They all have babies.
So that would be an inpatient, and so let's do cesarean section. And we will do Yeah, I don't see Wyndham Hospital. That's a really
Not even for regular baby delivery? They're
let's
not
see.
on there?
Vaginal delivery. All right, let's see that.
Would they
Not
be under Hartford Healthcare? Is Hartford Healthcare grouped in with all of their hospitals? So like the Norwich Hospital, the Wyndham Hospital?
That's a good question. That is a very good question. Is Hartford Healthcare lumping everybody in together? Yeah, I don't know. Let's try it from Hartford. So, Hartford. So let's see if there's a vaginal delivery. We'll do all of Connecticut, starting in Hartford. Oh. That's weird that it's an inpatient and outpatient. Yeah, so I don't see it. I don't see even Hartford Hospital here, and I'm very surprised by that because I feel like I've seen Hartford Hospital for other things.
On the example on your slide, Hartford Hospital is there.
Okay, but for some reason it doesn't list Hartford Hospital as a provider for cesarean sections or for vaginal delivery.
I find that unbelievable.
Yeah, I agree with that statement. And it's also interesting that Wyndham Hospital isn't on there. I mean, I haven't like, you know, tested out specifically for Wyndham Hospital. Let me refresh it and see if anything changes.
And Quinn, so I'm just doing it for cesarean section, for C-section inpatient, and Hartford Hospital is coming up, but you're right, Wyndham is not. So I think that's a question that we can go back and ask OHS and see if they are aggregating.
Yeah.
That would be useless for me because I'm not,
Right.
you know, I want to know what's going to go on really in my community hospital.
Right. Yeah. No, I think that's a really good point.
And I guess I would really like to know why we're doing this and why we created this and what they think the use of it is, other than just having information. Because like I said, I think many people feel they have no control over their health care, that their doctors tell them what tests they can have, that what medications they can have or can't have. They can't really control it very much. They can't, you know, be discharged or be when they feel that they want to go home or need to go home, and that you can feel that it's going to be a $20,000 baby delivery, and then you get out and it's a $40,000 one, and you try to get an answer as to why did it just double in price, and you can't get that. Or they'll say that you had a complication. Well, what complication did I have? You know, oh, something very minor, but that very minor thing just doubled the price, because we don't have any control to say, no, that wasn't really a problem. I mean, I think that we need to take, this is a personal opinion, we need to take more control over this industry. It needs to be consumer driven. So if I don't get good customer service, I'm going to go somewhere else. But we're kind of captivated by locality and our insurance companies and what they cover and who they cover and where they cover. So having average prices, I guess, is interesting. But if I can't use it as a consumer, then it could be far more effective if I was able to say, okay, listen, you guys say that this procedure is $5,000. Here's my written estimate, and it's now $7,000. What happened? And you need to explain, or at least come to me and say, listen, you know, because you have diabetes, this is going to cost a little bit more than we had originally estimated, or something like that. But I mean, this is the only place where you can get billed anything and any amount, and you really don't have any say over it.
Yeah, no, I hear that, Diane. And I think there's that sense of frustration from a lot of consumers that we've talked to. And so your question of how to make use of this tool is a good one. I do know that, you know, having at least a reference point that's based on state gathered data could be helpful for insurance companies, and also perhaps in legal proceedings. You know, it's information, or it's a data point. But yes, how much can you use it to negotiate before you're charged that amount, or after you're charged that amount? How much can you use it to ensure that you're charged a rate that feels fair to you? That's a good question. I don't know. I think it's a valid piece of data point to refer to, but I think on an individual basis from hospital to hospital, it's unclear how much leeway they'll give to this information.
I think it becomes more and more important as our deductibles become bigger and bigger and bigger over time, and less things are covered by insurance companies and more is being covered out of pocket. So as the Chamber of Commerce and from a business perspective, it would be really important for me as a business owner, especially since now many of us are going to self-pay insurance policy. So if I have an employee that I'm paying all their medical costs for, I want them to be able to go to the most affordable place. I want to be able to negotiate those prices. I want to be able to tell them, sorry, no, you can't go to Glastonbury or Stamford where it's $5,000. You need to go to, you know, Danielson or Wyndham where it's $3,000, and that's all I'm willing to pay. But if these prices are just really up in the air without any really calculation behind it other than the hospital or doctor checking a box randomly. I can tell you personally, I went into a regular annual checkup for my woman doctor, my OBGYN, and she said, how's it going? I'm like, oh, good. And she asked me how my boyfriend was. And I said, oh, he left me and he's now living in Florida. And she goes, oh, I go, yeah, I know. It's a little sad and stuff. And then I find out later I get hit with a $500 bill instead of it being free as my annual checkup because she put down on the thing that I was depressed.
That's
so now
terrible.
I have depression, and now it took me a year to fight that and get it off. I was like, I wasn't depressed. I was depressed for 5 minutes, and then I was celebrating. Why the heck did you put that down on there? I was happy to be rid of them.
That's terrible. I'm so sorry you had that.
But that's what I'm saying is we don't have any control over these things. You know, literally you check a box and your diagnosis changes, and then the prices change, and you know the average person might not know that they could even fight or argue that and get that price reduced.
Yeah, I mean, yeah, based on my very limited understanding of the law around this and legal proceedings, I do think that this could be a useful tool as that reference point, because these are the median costs that insurance companies have paid out. So it's not a random number that comes up. So I think you can rely on these numbers to a certain extent. It's just like, if you, yeah, the individual circumstances are going to be different depending on what insurer you have and what is your particular kind of insurance company. But I hear your point. It does feel like there's a lot of power in the providers. In your instance, that seemed like an egregious breach of trust, and that needs to be reported somewhere. And I don't know if you know about the Office of the Healthcare Advocate. They're a state agency that will, listen. Have you reached out to them at all?
Oh no, this is a while ago. I fought it with the insurance company and with the doctor's office. Let me tell you, I certainly let the office know that was a serious issue and that they needed to remedy it. And they did eventually, but it took a while for that to take place. I think it's really easy, it's really easy to document things that stick with you. And I see now in some doctor's offices and some healthcare, I think a lot of lifestyle questions are being asked that are really not pertinent and violate maybe some kind of privacy laws. And why you would need to know that, I don't understand, but it's happening. And so we need to gain, this is kind of off topic, but I really think that the consumer needs to get control of this. And obviously if you're really sick and you're dying, you want people to do whatever they can for you. So you kind of lose some control there because you want them to save your life, for example. But on a lot of the routine stuff, I think there needs to be some consumer-based control.
Yeah, no, I hear that, and I appreciate
costs down. We definitely keep costs down, and I think the insurance companies may not always have the time to negotiate prices with healthcare services, but we do if it's coming out of our pocket, or if they're able to because they have a contract with that particular provider. Then why can't we also negotiate and come up with an agreement? So yeah, you asked for discussion and stuff to take back. I think that this would be great if it's really functional, and that the Office of Health Strategy can work out a better system for consumers.
Yeah, no, I love it. I love all the points that you've uplifted, Diane, and we'll definitely bring that feedback back to the Office of Health Strategy. I think in the future, if you see any other kinds of egregious activities happening in healthcare offices, you might want to report it to the Office of the Healthcare Advocate, simply because if it's happening to you, it might be happening to other people. And the Office of the Healthcare Advocate, their job is to investigate provider issues to make sure that it doesn't negatively affect anybody. And they can bring legal proceedings, and they can, you know, do all sorts of things to make sure that the doctors and healthcare providers that are abusing the system to overcharge their customers like you are being dealt with accordingly. So yeah, I'm so sorry you had that experience.
Well, I think that this could be a valuable tool in something like that, and that you don't know you're being overcharged if you don't know what an average price is. You know, you just get the bill. You don't know what normal is.
Yeah. Yeah, and just to be clear, it's the median price. It's not the average price.
Right.
So it's like, yeah, the price that's charged.
And so that's what I'm saying is, you know, you're grouping everything in for that procedure, but I think that the information, the data would be more pertinent if it was, here is the cesarean without any complications, underlying issues, and then you have cesarean with complications, and seeing those prices. But there's no way you can go from 10,000 to 90,000 on the same procedure without there have been a complication or something that happened. And that really should be removed. And so you would get a more accurate median price for those procedures if those with or without complications were separated. That might be some additional feedback to make it more effective.
Yeah, no, I love it. That's very helpful feedback. Yeah. Have any of you had a chance to hop onto the cost estimator and try it out? You have, Diane.
Yeah, okay. So I think, like, the reason I asked you about Wyndham Hospital, I don't see a lot of the smaller hospitals on there. And, you know, doctors' offices, obviously, there's so many of them, but, you know, the little country people I don't see that.
So rural health consumers might be disadvantaged by the lack of information about that. Yeah, that's great feedback. Did you find anything was easy or difficult to use? Was there anything that was confusing?
I thought it was pretty straightforward.
Okay. And what do you think is the most important feature of the cost estimator?
Well, that's a good question. The most important feature. It's hard for me to answer that question right now because I'm thinking my hospital wasn't there. So that would have been probably the most important thing, is to see what the cost in my local provider would be. So that was kind of hard to say if I don't see it there. I think it was very interesting to see the high and the low range. But again, I would want to know if that was routine or with complications, and then see the high and the low range.
Yeah.
Because, you know, I mean, if there's no complications, there shouldn't be a high and a low range. You should be pretty much right there. So I think it would be interesting to see if that's true or not.
Yeah, that's great feedback. Yuki?
I mean, yes.
I think the tool is pretty user-friendly. I'm on it right now, just kind of clicking around. I do think the actual breakdown cost is helpful, and just as a reference point for medical cost. Now my question is, I do have a question though. The outpatient services and inpatient services, in the future, is there any room to add any more services, or these are the only ones that you will be able to provide?
Yeah, that's a really good question. My understanding is they're continuing to add outpatient and inpatient services by the month. I think when they first released this in November, there were like half as many outpatient and inpatient services, and now they're just adding more and more. I'm not sure why they prioritize certain services rather than others. So if there are any services that you feel like are missing, that you feel like should be on there, let us know.
Okay. And another thing is, would the cost estimator have a translation component to it so that just in case someone who doesn't speak English, would they be able to use it?
Yeah, so here there is a Spanish translator. I don't know if you can see this, but if you click on Spanish, it'll turn to Spanish. But I don't think they do it for all languages. And the problem with Spanish that we've discovered, I don't know if they've updated this, but you know, this part is in Spanish, and this part is still in English. And none of this is translated to Spanish. So that's something that we have realized about this tool, and we're going to highlight. Yeah, that's a good point. Thanks for bringing that up.
But other than that, I think it's a good starting point for people to kind of just look at the cost before they get into any kind of medical care.
Okay, thank you, Yuki. Yeah. Steve, did you have any thoughts?
No, I've been playing with it, and it's quite interesting. It's more of an information-based tool at this point, because if I'm locked in with my insurance company, I may not be able to go out of network and do this. So other than that, I think it's helpful, but I'm just not sure what to do with the information at the moment. So hopefully at some point I'll be able to apply it to a real life situation. Does that make sense?
Yeah, no, I appreciate that feedback. Yeah, so when you look at it, there's no immediate idea about like what to do with this information. It is nice to have the information, but yeah, how do you make it actionable? That's a
right. If I have a deductible, I have to pay the deductible anyway with my insurance, right? That's not going to change. And some of the costs, whether I know it or not, I don't really have any say, because I'm not going to, even if one hospital on the other side of the state was going to save me some money, I don't think my insurance would pay for out of network, or it would increase my cost, so there wouldn't be any savings. So I have to figure out how to apply this information to a real life situation. And that part I'm still trying to figure out.
Yeah, I think you elevate a really good point about insurance and like out of network versus in network. And even if it looks like you can get a lower cost of service elsewhere, if it's out of network, then it's not useful for you. That's a really good point.
Yep. But other than that, it's a good start, and hopefully over time this will grow, and I'm looking forward to the next version.
Yeah, I guess like, well, that's where I'm curious, like what would be in the next version, or what should the next version look like, or how do you make the next version more useful to people? What is this missing?
Well, how about, is there an FAQ? I didn't see an FAQ on here.
There's instructions and overview right here. It's like right in this gray bar, and if you press the minus thing, then it comes out. So like it's this whole expanded menu, and there are all these definitions that are listed, including why the median cost calculations, inpatient versus outpatient costs. Like all the information I shared with you today is based on this area. Do you see it?
Yep, I found it. Thank you. Yeah, no, I think we just have to use it and play with it. And like anything, once you start implementing and you get feedback from people, I think that will help guide the next variation of this. Again, right now, I think part of the challenge is because of our insurance, we're kind of stuck, right? We don't really have much say. And even though we get the median cost, that's not the fee that your insurance company has negotiated with this hospital. So, you know, again, I think at the moment, I just have to figure out what it means if we're out of the loop. And I'll just leave it at that, because I don't know what else to add at the moment. Thank you.
Yeah, thank you, Steve. That was very helpful. Yeah. Any other thoughts on the cost estimator or how it can be improved?
I think it was really great of you to come and talk to us about this. I think it has a lot of potential, especially if people cooperate and you know, with your department. I think it has a lot of potential for consumers in particular.
Thank you, Diane. Yeah, we're hoping that your feedback is going to get them to shift and change and improve the tool a lot more and make it more consumer friendly. I think you're right, there's a gap.
Will you keep us informed? Will you let us know if there's any changes to this or if things, you know, evolve?
Yeah, absolutely. I'm going to draft the report soon by the end of this month, and then I'm going to submit it to them. And yeah, if I hear of any updates or anything, I'm going to let Yuki know, and then, you know, I'll share the information with you. I think it might take them a couple of months to update things, and when they're updating, they might take it offline for a little bit. But yeah, it's definitely going to be done. They're very interested in improving the tool. So
great, awesome.
Right.
Well, I appreciate you and Dashni taking time today to come and talk to us and solicit our input. That was very nice of you, and we appreciate being considered. I wish you the best of luck in this project, and we look forward to hearing an update from you as to how this has evolved. So thank you again very much for coming. And this weekend is a holiday weekend, so have fun and enjoy the beautiful weather.
Awesome. Thank you so much, Diane and Yuki and Steve, for having me on this call and for organizing it. This is great. Thank you.
Thanks, folks. We appreciate you attending the webinar today, and we look forward to seeing you or hearing from you at our next one. Yuki, thank you to the town of Windham, and we will be in touch very shortly.
Yes.
Bye-bye.
Thank you, Quinn. Bye.
Take care. Bye. Thank you.